Well, hello, everyone. This is Melanie Jones,
And I'm Dr. Michael Hendrickson.
and we are excited to bring you another episode of the Bridge Street Health Seminars. Today is one of the topics that is near and dear to my heart, or maybe I should say near and dear to my gut. It's all about gut health. And this is just something that I think is so important for everyone to have a better understanding because it's so fundamental to our overall health. Dr. Hendrickson, I'm curious to kind of start with your thoughts about the gut and what you've seen in practice as far as how it's important to health.
Well, I know you're excited about this. And actually, I've become more and more excited with you in this journey. But I have come to realize that the gut, the gastrointestinal tract, is a very complicated, very sophisticated organ in our body. I think it's much more sophisticated than we even realize. I think in the past, we have thought it was mainly for digestion, but it has many more functions than that. It's involved in immune health, brain health, bone health, emotional health. It has its own nervous system. There's estimated between 2 and 600 million nerves in the gastrointestinal tract. There's communication between the gastrointestinal tract and the brain. There's more communication between the gut and the brain than any other organ in the body. And it's pretty marvelous how it's really a hollow tube that runs through our body, starting from our mouth and ending at the anus. And it's really an external environment that travels inside of us. And it's full of bacteria, it's full of chemicals, and what I have described at times as a real witch's brew of things that are needed to help digest food and activation of different enzymes and, all of that. And I really become fascinated by the different levels of the gut, starting at the mouth and through the esophagus into the stomach, which is a very, very acidic environment. But then as you go from the stomach to the small bowel, that pH changes very rapidly, and it needs to. And then when you get into this large bowel, it changes again. And all that is very important because it allows activation of certain enzymes that are needed for that particular area of the bowel. Also, the bacteria. There's certain areas of the bowel where you don't want a lot of bacteria and other parts where you do. And the other thing that's amazing about the GI tract, especially when you're talking about the small bowel and the large bowel, is that you are being protected by one cell layer thickness from the outside world. And it's amazing that it allows good things to be transported across that membrane, and it keeps the bad stuff out. So it's a fascinating, very complex organ. And I know you're going to get into a lot of fascinating things here. I can't wait to hear what you've got.
So just to emphasize one thing you said, because I think it's really important and people may not appreciate that, but there's one cell layer that basically separates the inside of this tube, which as you just described, can be incredibly acidic. a witch's brew, as you call it, is filled with bacteria from the inside of the body, which, has to maintain a very stable pH, not acidic, or not as acidic, and also has to remain sterile, because when that bacteria would get into the body, I imagine that is not a good thing to happen, right?
A lot of bad things happen when that occurs. But it's not only just the bacteria, but it's to keep out certain toxins and other things, even certain immune cells you want to keep out of there. So it's very highly regulated. And I don't think we appreciate it enough, what it does.
Yeah.
And that's what Nourish to Flourish is going to help us with.
Absolutely. I think one of the things that's been so remarkable on my journey into functional medicine and working with patients is how, when you change the gut, when you improve gut health, how things that seem unrelated to gut health, whether it's skin issues or headaches or sleep issues, those also seem to improve rapidly. And so I think, as we said at the beginning, gut health is just foundational to overall health. And that's really what Nourish to Flourish is designed to improve gut health, because we control what we're feeding and how what the makeup is in our guts, and we'll get into that a little bit more. Before we do that, I'm curious for you to share with our listeners our experience with one particular patient. We can call him Jim here, but can you tell our listeners a little bit about what happened with Jim?
Yes, this is quite a story. We saw a patient here in the office that was scheduled to have a major surgery done in a couple of days. He was actually going to have part of his colon resected because of recurrent, what was presumed to be diverticulitis in his colon.
And by resected, what do you mean by that?
They were going to cut it out.
They were going to take out part of his colon.
Going to take out part of his colon.
That doesn't sound good.
No. Not a good thing. And, I remember one of the statements he said to me, he said, "Give me a reason not to have this surgery." And I said, well, let's investigate this a little bit further. So we looked at some of the imaging, his scans that he had, and some different things. And it was felt that maybe if we could change the health of his gut, especially the colon, that maybe he could avoid this surgery.
Now, as I recall, he had had years and years of pain in his abdomen prior to this.
Recurrent episodes for 20 years of intermittent episodes of pain, multiple emergency room visits, multiple scans that were done. And the conclusion was, we don't know what else to do other than take the part of the colon out that we think is causing this. And we saw him, and he did essentially the Nourish to Flourish.
That's right.
And his pain has resolved. For now, we've saved him a surgery. It's possible that at some point he might need surgery, but the hope is that we can avoid that. And I think we have. We have probably improved his barrier, that barrier in the colon now, to where he's not prone to things that he was prone to in the past.
Yeah. And it's been quite a few months since he first presented to us. And last we saw him recently, he wasn't having any pain at all.
No. And he feels better than he has felt. He's excited about his health. And it just goes to show you, you're only as healthy as your gut health.
Music to my ears. So let's talk a little bit more about what we're talking about and how we influence the gut. So a word that we hear a lot about, or maybe it's just me, but the microbiome is kind of a fancy word for this whole galaxy of microscopic entities that live in our GI symptom. So there's different ones that kind of live in different parts, but for the purpose of what I'm talking about here, I'm really talking about that large bowel, the large intestine or the colon, which has just trillions and trillions of bacterial cells. I think the latest estimate I've seen is there's about 38 trillion bacterial cells that live in our gut, the majority of which live in our colon. And just to put that in perspective, if you took all the people that live on the planet and multiplied that by 5,000, you'd get somewhere to the number of bacterial cells that live in each of our guts. So it's just an enormous population. And every single square centimeter or whatever the smallest particle you can think of size is, these bacteria live, and they compete with each other. Their goal is to grow and to reproduce, and they're very territorial. They don't like new guys moving into the neighborhood. And basically they serve very important biological functions. As you mentioned, they help us to digest our food. They activate chemicals and vitamins and hormones and influence things like how our body uses fuel, how glucose and insulin are used. And they also produce things called short chain fatty acids. One of these is called butyrate. And that butyrate is the preferred food source for those colon cells, the cells that you mentioned that create that barrier, that lining that keeps the rest of the body from being invaded by what's going through the colon. And so that's incredibly important. And that is influenced by what we eat, which is really why the Nourish to Flourish program is so vegetable and fiber rich, or hopefully it is for you, because if you're feeding those bacteria all of that fiber and a variety of fiber, they are producing more of that butyrate. And so that butyrate's important because the more butyrate you have, the less inflammation you have. There's been studies that have shown it improves insulin sensitivity and lipid metabolism. So you really want those bacteria to produce as much of these short chain fatty acids as possible. The other thing that is important to know about the microbiome is that it influences things like our cravings, because there's certain bacteria who thrive on simple sugar and want more of that. So, it may not be all in your head as far as, when you feel the M&Ms calling at 3 p.m., it may literally be your microbiome saying, hey, we're hungry and we want some of that food source. Now, with Nourish to Flourish, obviously, we're eliminating added sugar. And so some of those bacteria that thrive on that are pretty upset about the change in food source. Now, they'll eventually lose some of the real estate that they occupy. And in place of them, the bacteria that are thriving on the fiber and vegetables are going to take over more territory. And that's a good thing, again, because that means more butyrate. So, some other things that affect our microbiome are things like stress. The stress hormones in our body can influence the makeup of our microbiome, different medications, and specifically antibiotics. So, antibiotics obviously are important when you have an infection, and they kill off bacteria in the body, but they also kill off bacteria in the gut. So, that can influence the makeup. Environmental exposure, different things that we come in contact with through, the environment or what we're eating, et cetera. All of those things affect us. And each person has a unique microbiome fingerprint. No two people have similar ones. But you want, again, the healthiest microbiome that you can have, and that includes having a diverse microbiome. Because all of these trillions of bacteria have different roles and different functions, and the more diversity you have, the better. I think of it a little bit like an orchestra, where you have a variety of different instruments that are playing, and to achieve the optimal sound, you need all of them playing together. And if you suddenly got rid of the flute section, you're obviously not going to make the same sound as if you have, all of those in your gut. So with the Nourish to Flourish program, we are really trying to optimize those bacteria that are working hard for us and having the beneficial effects that we want them to. So again, we want to create that gut lining that is really sturdy. And recently I've been thinking about this a little bit like an airport security system. So if we think about the airport, and there's walls around the airport that make sure there's no invaders that are getting in from the outside, but there's also this area, the security area of an airport. So that keeps people who are not supposed to be in the secure area of the airport, that are getting ready to fly, from people that are going by and dropping people off, and potentially are could be risks to the security of the airport. So if we think about the microbiome or all those bacteria I mentioned, they're kind of in the non-secure area of the airport. And there's, trillions of them, as I mentioned. Then we've got the TSA area that's monitoring who gets in and who stays out. And if we think about if that TSA area broke down, if all of a sudden the X-ray machines and things allowed invaders in, it could be a real risk, right? If you do not want the bad guys to get into the secure area of the airport. And so there's a security team, which are immune cells, that are kind of monitoring this. Think of them as the TSA agents that are working to keep the security. So if all of a sudden the bacteria are getting into the secure area of the airport, that security team is taking action. And that's where I think, depending what you're eating, or if you're breaking down that security system, then you're getting that immune response, that security response that's saying, hey, there's someone in here that shouldn't be here, and that can have effects all over the body. So really important to keep that security system intact, to keep those TSA agents working hard, and keep the bacteria on the right side of the airport, so to speak.
And just to add to that too, I think what's fascinating is some of the bacteria they have binding sites on the epithelium, the lining of the colon, and they compete for those binding sites. So if you don't have the good bacteria that bind there, there's more room for the bad bacteria to bind and cause adverse effects on that cellular barrier. So we want that diverse bacteria, and you want good bacteria.
Yeah.
You need some good bacteria, and we help them and they help us.
Definitely a symbiotic relationship, right?
Right.
Yeah. Okay, so I think with Nourish to Flourish, there's several different food groups that we're eliminating, and really that's in an attempt to influence which bacteria are thriving in our guts. Again, we're eliminating the food source for those bacteria that may not be as beneficial, such as those that thrive on simple sugar. They don't completely go away. They're still there, but because they are not getting their normal food source again, they are not able to thrive and reproduce and, again, take up as much real estate in the area, as opposed to as we change our diets and now we're eating foods that are more nutrient dense, that are creating basically the prebiotic is one of the terms that you hear, but basically a prebiotic is just the food that bacteria or the probiotic thrives on, in order that those bacteria are able to produce what's called a postbiotic, which again are those beneficial building blocks, cellular building blocks, or food source, as the case might be with butyrate, for our cells and our bodies to be able to do all that it needs to do. We will talk more about the negative effects of sugar, artificial sugar, et cetera, in another seminar. But just know that sugar basically produces pro-inflammatory cytokines, which is just another fancy way of saying it creates inflammation. So basically, sugar is affecting those TSA agents and not allowing them to do their job well. So by eliminating that, we're helping to bolster that security system. And the same, while grains and dairy and alcohol is probably a different one, but those are not necessarily having the same impact as sugar. We're really trying to create an optimal environment for the best possible bacteria to grow and thrive and do what it needs to do. So I think, the old saying, you are what you eat, really comes to be true in this case. And I came across a quote that's attributed to Thomas Edison, who back in the early 1900s, in 1903, he was credited with saying, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease." And obviously that hasn't necessarily proven to be the case, although I think there is a shift in interest in medicine, this whole idea of kind of lifestyle medicine and how what we eat, how we move our bodies, the sleep we get is coming back into more mainstream medicine. And certainly that's what we practice, or you practice here at Bridge Street Health, as far as, taking an interest in helping people to reboot their guts through programs like Nourish to Flourish and how that can help. I'm curious, you've been through Nourish to Flourish before. What has been your experience, and what advice might you give to our participants as they're doing this program?
So the advice I would give would be to be all in. It's a small price to pay for 25 days of making a dietary and a lifestyle change. And I have found, I was fascinated going through this. I lost a significant amount of weight, but this wasn't a caloric restricted diet. And I was eating fruit, probably more fruit than I ever had, which does have sugar in it.
Naturally occurring sugar.
Naturally occurring sugar, which is different.
Right.
And I think some of the aches and pains that I had were much improved. I feel much better. The other thing that was curious to me, I had my gallbladder taken out when I was in medical school and kind of suffered with bowel issues since that time. And I took a medicine for that called cholestyramine. My family knows all about cholestyramine. And anyway, since I went through Nourish to Flourish, I have not needed that. So I went, 20 years, 30 years taking that fairly not every day, but fairly regularly. I haven't taken that in probably 3 months. So I'm a real believer in the Nourish to Flourish. I'm a real believer in a healthy gastrointestinal tract. The other thing that I'm probably taking less of now is anti-inflammatory medicines that I took probably more so in the past. And also, I I think medicines, sometimes we don't realize the effect that medicines have on the gastrointestinal tract. It's thought that the one medicine that has the most profound effect on gut health is the proton pump inhibitors, the medicines like omeprazole and Nexium and all of those. And there's a reason why, because whenever you lower the pH, you can get an overgrowth of certain bacteria in certain places that it's not intended to be. And it can disrupt a lot of things. So I rarely, if ever, take omeprazole, which I took on occasion. I don't take that very much. No anti-inflammatory medicines to speak of much. So overall, I feel much better. I would recommend to just go all in. Do it all. Do it all. I was a little whiny in the beginning, I will admit, but I did it with my wife, and it's always helpful to do it with somebody else or have a community that you do it with. It makes it so much easier. And we have that here.
Right. Yeah.
So
I think one other thing that I'd love to hear your comments on are, as we've done this a few times now, we're seeing some perhaps surprising changes in some of the lab values over a really short period of time. We're looking at lab values basically within 3 to 4 weeks from kind of start to finish. And this is not a low cholesterol diet, right? The Nourish to Flourish, there's lots of eggs and things that traditionally we've thought have been, considered high cholesterol. Can you comment on what you're seeing in patients as far as changes in their labs?
We have data that is very revealing, and it has really been fascinating how much of an improvement the cholesterol numbers have been across the board, nearly across the board. If you adhere to this for the 25 days, I can almost guarantee you your cholesterol numbers are going to improve. If you're on cholesterol medicines, they dramatically improve in addition. So there's been some profound effects there, and it's not a low cholesterol diet. I mean, we have people eating steaks and different things and eggs and all of that, and their cholesterol has dropped in a couple patients as much as 40%, which is profound. Also, we have seen an improvement in blood sugar and maybe even more importantly, insulin levels, which really suggests to me that this resetting of the gut really reduces your insulin resistance and makes the insulin work better at the cellular level.
And is that important for, or I guess I should ask the question, what's that important for?
For everything.
There you go.
For everything.
Yeah. Well, I think that concludes what we wanted to talk about today. We'll talk more about other things that influence gut health as we go, but hope you've learned a little bit and have a greater appreciation for what I like to think of as our microscopic friends that are working hard for us each and every day.